People often say pregnancy is one of the most beautiful phases in a woman's life, full of glow and happiness. But the truth is, especially in the first trimester, there are intense changes in the body and mind that very few people talk about openly. The beginning of pregnancy can feel like a roller coaster. Extreme tiredness, unexpected nausea, mood swings, and even strange symptoms that catch many moms-to-be by surprise. And guess what? It's completely normal to feel this way. These changes are just your body adapting to grow new life. In this video, you'll discover the surprising truths about the first trimester of pregnancy that nobody tells you. From the very first signs to the emotional and physical changes that are often left unspoken. Stay with me until the end, because I'll reveal a curious detail about the first trimester that surprises even women who have already been pregnant before. But before we dive into this important topic, make sure to subscribe to the channel. Hit the like button and turn on the notification bell so you don't miss any of our upcoming tips on motherhood and health. Now, let's begin by understanding the discovery of pregnancy and the very first signs that show up. For many women, the first experience of pregnancy comes as a surprise. Sometimes it's a missed period that raises suspicion. Other times, subtle symptoms show up even before the positive test. The most common early signs include missed period, usually the first clue. Nausea and vomiting, often called morning sickness, though it can happen any time of day. Breast tenderness, with breasts feeling heavier and more sensitive. Extreme fatigue, caused by hormonal changes. Mood swings, linked to the body's rapid adjustments. But every woman's experience is different. Some go through the first weeks with almost no symptoms, while others feel everything very strongly. This stage can also bring mixed emotions: surprise, happiness, fear, and even insecurity. After all, the news of pregnancy represents a major life change. Something few people mention is that even before the belly grows, many women already feel big changes in their body and emotions. It's as if the body quietly begins preparing for a unique journey. In short, the first trimester starts with signs that vary greatly from woman to woman, but they all mark the beginning of one of the most intense phases of life. One of the biggest surprises of the first trimester is the hormonal surge happening in a woman's body. These hormones are essential to sustain pregnancy and support the baby's development, but they're also behind many unexpected symptoms: HCG, human chorionic gonadotropin, often called the pregnancy hormone. It keeps progesterone production going and is the main cause of nausea in early pregnancy. Progesterone prepares the uterus to support pregnancy, but can also cause sleepiness, constipation, and bloating. Estrogen increases blood circulation and strongly affects mood, leading to emotional ups and downs as well as breast tenderness. This hormonal dance is intense and can make a woman feel like she's on a roller coaster, full of energy, one moment, completely exhausted the next. What few people mention is that these changes are not just side effects. They're part of the body's smart design to create the perfect conditions for the baby to grow safely. In short, first trimester hormones are the true architects of pregnancy. They build the foundation for life while deeply transforming the mother's body. If there's one almost universal symptom in the first trimester, it's extreme fatigue. Many women describe feeling unusually exhausted, even after a full night's sleep. There are clear reasons for this. The body is working at high speed to build the placenta, increase blood volume, and support all the changes needed for the baby's growth. On top of that, progesterone, which rises during this time, has a calming and sedative effect, adding to the sleepiness. The energy demand is so high that many women feel like they've run a marathon, even while doing simple daily tasks. Something rarely mentioned is the guilt some moms-to-be feel for not keeping the same pace as before pregnancy. It's important to remember that this fatigue isn't laziness. It's the body redirecting energy to the baby's development. Helpful strategies include short naps during the day, keeping a regular sleep routine, eating balanced meals, and reducing tiring activities whenever possible. In short, extreme fatigue is one of the most common first trimester symptoms and should be seen as a natural part of the body adapting to pregnancy. Perhaps the most famous first trimester symptom is morning sickness. Many pregnant women report strong nausea, especially in the morning, but the truth is it can happen at any time of the day. The main cause is HCG, the pregnancy hormone, which peaks during the early weeks. Along with nausea, it's common to develop aversions to certain smells or foods, even to favorites from before. On the other hand, some women experience unexpected cravings, often for unusual food combinations. These food changes can feel strange, but they're a natural part of the body's adjustment. The challenge is keeping a balanced diet despite the nausea. Some helpful strategies include eating small meals throughout the day instead of large ones, choosing light, easy-to-digest foods, avoiding strong smells that often make nausea worse. Staying well hydrated. Something rarely mentioned is that, in some cases, nausea can become so severe that it causes weight loss and dehydration, a condition called hyperemesis gravidarum, which needs medical care. In short, nausea, cravings, and food aversions are trademarks of the first trimester, and learning to handle them is part of adapting to this stage. The first trimester doesn't only bring physical changes. The emotional and psychological transformations are also intense and often unexpected hormones. Especially estrogen and progesterone directly affect mood, causing swings that can shift from excitement to irritability within minutes. On top of that, the news of pregnancy itself can trigger mixed feelings: happiness, fear, insecurity, anxiety. Many women worry about the baby's health, the lifestyle changes to come, their professional life, and even their relationship. Something rarely mentioned is the feeling of loneliness some women experience, even when surrounded by people. This happens because every pregnancy is unique, and not everyone around them can fully understand what they're going through. Emotional support is key. Talking to a partner, other moms, or joining pregnancy groups can bring relief and comfort. In some cases, seeking professional help from a psychologist is also very valuable. In short, the first trimester is also an emotional journey. Acknowledging and embracing these feelings is an essential part of caring for the mom-to-be. When we think about pregnancy, we often picture the growing belly. But in the first trimester, many physical changes already happen, and few people talk about them. Many women notice bloating in the first weeks, caused by progesterone, which slows down digestion. Gas and heartburn are also common, due to hormonal changes and pressure building in the digestive system. Breasts become larger and more sensitive, preparing for breastfeeding long before the baby arrives. Skin changes too. Some women notice more oiliness and acne, while others experience dryness. These transformations can feel surprising or even uncomfortable, especially since many women don't expect them so early. Another little discussed symptom is the increased need to pee. Even though the uterus is still small, it already starts pressing on the bladder. While common, many women feel embarrassed to talk about these issues. But it's important to know, these changes are clear signs that the body is smartly adapting to this new stage. In short, the body starts transforming from day one of pregnancy, and recognizing these signs makes it easier to embrace this stage full of discoveries. The first trimester is one of the most delicate stages of pregnancy, which is why early prenatal care is essential. Many women don't realize it, but those first appointments and exams make a big difference for both mom and baby. The first visit usually happens right after confirming the pregnancy. The doctor reviews the woman's health history, lifestyle, and gives immediate guidance. The most important tests include blood tests to check for anemia, glucose, thyroid, infections, and blood type, urine test to rule out urinary infections, which are common in pregnancy. First trimester ultrasound, which confirms gestational age, checks embryo development, and identifies multiple pregnancies. Another key point is folic acid, ideally started before pregnancy or as early as possible, since it helps prevent neural tube defects in the baby. Something rarely mentioned is that prenatal care isn't only about monitoring the baby, it's also about supporting the mother's physical and emotional health. It's a safe space to ask questions, discuss insecurities, and receive proper guidance. In short, early prenatal care, with the right appointments and exams, lays the foundation for a safer, smoother pregnancy. With so many changes in the first trimester, some women forget about basic self-care that makes a big difference during pregnancy. Balanced diet. Due to nausea or cravings, many moms-to-be end up overdoing certain foods while skipping important nutrients. Eating fruits, vegetables, proteins, and whole grains is key for both mom's well-being and baby's development. Proper exercise. Contrary to what some think, light and guided physical activity is beneficial. Walking, stretching, and pregnancy safe. Exercises improve circulation and reduce discomfort. Quality sleep. Rest is often underestimated, but the body needs it to recharge. Building a consistent sleep routine helps deal with first trimester fatigue. Mental health. Stress and anxiety are common early on. Relaxation practices like meditation and deep breathing can help a lot. One rarely mentioned point is the use of medications and substances. Many women don't realize that even simple medicines, like painkillers, must be approved by a doctor to avoid risks to the baby. In short, basic care with diet, exercise, sleep, and mental health is essential in the first trimester, but often forgotten amid all the changes of pregnancy. Now I want to hear from you. Every pregnancy is unique, and the first trimester usually brings many unexpected discoveries. Some women experience strong nausea, others deal with extreme fatigue, and some go through it almost without symptoms. What was the most surprising thing you discovered during your first trimester of pregnancy? Was it an unexpected symptom? A change in your body? Or even an emotion you never thought you'd feel? Share your experience in the comments. Your answer might help other moms-to-be who are going through this intense and confusing stage. Remember, sharing stories is a powerful way to support and comfort other women experiencing the same moment. We've reached the end of our video about the first trimester of pregnancy and the surprising truths nobody tells you. We've seen that this stage is full of intense physical, hormonal, and emotional changes, and that every woman experiences it differently. We talked about the first signs, the impact of hormones, extreme fatigue, nausea, emotional changes, body adjustments, and the importance of early prenatal care. More importantly, we highlighted that feeling all this, or barely feeling anything, is completely normal. Now I invite you to subscribe to the channel, hit the like button, and share this video with other women who are going through this stage or will soon experience it. And don't forget to comment below with the biggest surprise you faced in your first trimester. Remember, this video is educational and does not replace medical advice. Always talk to your doctor about any symptoms or concerns during pregnancy. Motherhood is a journey full of discoveries, and with the right information and support, it becomes lighter and more special.